Happy New Year! Happy Friday! Happy last day of 2021. How's everyone doing? How was your holiday season? How's your body doing after all of the decadence and indulgence? Well, welcome to today's Tiny Tune-Up. It's our last one of 2021. If you're watching, please say hello, and if you're watching on replay, give me a hashtag replay. Today we're going to talk about 3 common myths about the IT band, the things that I hear on a regular basis that are incorrect misconceptions about your IT band. So what is your IT band? Most people, if you've had any kind of leg issues in your whole life, you've heard of your IT band. It stands for iliotibial band, which refers to the 2 attachment points, to the 2 bones that it attaches to. So ilio refers to your ilium, and that is your the large panels of your pelvis. Get skelly involved here. Here's your ilium right here. And tibial refers to, of course, your tibia, which is one of the lower leg bones. So your iliotibial band, your IT band, originates up here on the edge of your pelvis, goes all the way down past the hip joint, down the whole side of the leg, past the knee joint, and attaches, sorry, I was pointing to the fibula there, but it attaches onto the tibia. So it is a soft tissue body that actually crosses over 2 joints, and it's one of the longest ones in the whole body. So today we're going to talk about 3 myths about this, I'm trying to be cryptic with my words, this soft tissue body. So there are a lot of injuries that are related to your IT band, and any issue in the IT band can result in knee pain, hip pain, ankle pain, foot pain. It can result in torques and twists in the pelvis, and even sometimes can start to kind of pull the ribs down towards the pelvis. So there's lots of things that the IT band can affect, and there's less things that can affect the IT band itself. So we're going to talk about that a little bit today. So let's go to the first myth. The first myth about, hello, I see somebody watching there. Hi. The first myth or sort of misconception that I hear a lot about the IT band is that it is a muscle. The IT band is not a muscle. That is false. The IT band is actually a tendon. So it sort of functions different from a muscle, and it has a different texture from muscle. So tendons are, they tend to be a little bit, they're more fibrous-y, wiry, a little bit thicker, a little bit harder to penetrate, and functionally they're quite different from muscles because they can't contract in the same way that muscle can contract. So tendons provide a lot of support. They have a lot of sort of stability function, and sometimes they can become very stiff. They can create sort of a springing off function. As in an example would be the Achilles tendon. They can really create like a buoyancy, but they cannot contract in the same way that muscle contracts. So the first myth is that IT bands are a tendon, or that are a muscle. They are not, they are a tendon. Myth number 2 is related to myth number 1. People often think that they're told that they have a tight IT band, or if they've been diagnosed with IT band syndrome, it's described to them as that their muscle is very tight, it's very short, and they need to lengthen the muscle. So because the IT band is a tendon and not a muscle, we actually cannot lengthen it. We can't stretch it in the same way. Muscles, we can stretch and actually achieve greater length and make them sort of change the whole length of a muscle. We cannot do that with tendons. So when someone is saying that they have a tight IT band, what they're really, the sensation that they have translates in their mind to tightness, but what it really is more like a stickiness, where the tissue itself is not receiving enough moisture, enough nutrients, enough oxygen, and it becomes sort of dry and sticky, and what it then does is gets glued to surrounding tissue, and we're going to talk about that part of it in more detail here soon. But myth number 2, you can lengthen the IT band. No, you cannot really lengthen the IT band. What you can do is unstick the IT band from surrounding tissue. And then the third myth is related, of course, to 1 and 2. And the third myth is that To relieve IT band pain or IT band related pain, or to lengthen the IT band, you should randomly roll up and down it with a foam roller. I think most of you have heard me talk about this before, but whether it's a foam roller or a ball or anything else, we never randomly go up and down. We want to follow the body's natural logic in order. It does not make sense to your body to roll in the opposite direction than the fibers of the tissue. In the case of the IT band, the fibers start up at that iliac crest, like I was showing you, and go all the way down the side of the leg and end at the knee. So we always roll the IT band from the top down to the bottom. So myth number 3, roll up and down the IT band to relieve soreness. This will actually create more confusion in your structure and in your neurological system. It will create discord and disharmony and can actually lead to injury. If you're rolling, if you're trying to teach the muscle fibers, or I should say the tendon fibers, to go the other direction than what they're meant to do, it's confusing the knee joint on one end, it's confusing the hip joint on the other end, and that translates into just mass confusion throughout the whole body. So what do you do if you have knee pain, hip pain, ankle pain that you think or have been told is related to your IT band? If you can't stretch it, what are you supposed to do? Well, the answer is you need to unstick it from the surrounding areas, as I mentioned, and the way that you do that is through a technique in Yamana body rolling called cross fibering. So cross fibering is still anatomically sound. What we're doing with cross fibering is we're intersecting the muscle fibers. So again, in the case of, I'll show you on a real body here, in the case of the IT band, you start up here and go down, right? It's a vertical tendon. So in order to unstick it from the surrounding tissue, which in this case is going to be mostly quads and a little bit of hamstrings, but mostly quads, the front of the thigh muscles, in order to get those two entities to unstick from each other, we cross fiber at their transition where they kind of bleed into one another. At this juncture, if we just keep sort of peeling apart the adhesions, eventually we have space, and now the IT band can function more optimally, as well as the quads can function more optimally. So the way to do that is actually pretty simple. So I'm going to show you now how you can do that with a Yamana ball, and I would suggest either a black ball or any of the Yamana balls will be fine for this. It depends on what you're going for. I thought I saw a comment there. If you're there, say hello. I see somebody watching. Any ball will work for this. The smaller the ball, the more intense it's going to be. So I would suggest if you really feel like you're super duper stuck together, then the best thing is going to be probably the black ball. But if you want a larger footprint, if you want a little bit less intensity, pearl, silver, gold, all would be fine. Silver is going to be more intense than the other two because the density of the ball is different. I am going to go for a black ball today. So here's what you're going to do to start to unstick the quad muscles here on the front of the thigh from the IT band, which again, when these two entities get stuck together, it yanks and pulls on the hips and the knee and really creates, certainly discomfort, sometimes pain, and even injury. So assuming that anytime you're about to do this in the IT band, I would recommend doing, rolling your sit bone first. I'm not going to spend a ton of time on this part. This is pretty basic. Most of you probably know how to roll your sit bone if you're watching this video. If you don't know how to roll your sit bone, check out one of my other videos that talk about that. To get to the main body, the area that people really feel is where they really notice the stickiness, is usually down past the hip joint. Now you can start all the way up at the top. For time's sake today, I'm going to show you just one area of sort of cross-fibering the IT band, but do know that you can do this starting all the way at the top and then continue down all the way past the knee. So we'll pretend that I've already done my circling on my sit bones, and in fact I actually have a little bit of while I was sitting there talking. And then you're going to start to turn to your side. Now I want to warn you, most of you probably know this already, the IT band is notoriously tight and can be painful for people when they start to roll through it. So keep that in mind, that this is not probably going to be one of the more like relaxing, kind of drift off, ride the wave kind of a Yamana routine. This is more of a really dig in deep and really start to find where there's adhesions and find those hot spots and peel them apart. So you can see I've been here for a few breaths. I would recommend having something to put under the side here if you feel like you want to kind of lounge. I'm going to grab a gold ball, but you could use, a yoga block, a pillow, a bolster, anything like that. I'm going to grab a gold ball because it's just the right size for me. And I've been sitting here for a bit. Now, to get to the cross-fibering part, I've been sitting here and breathing and letting the ball penetrate through the tissue all the way to the ITBN itself, and even trying to get through that to the bone. So the longer you stay, the more effective that will be. And when you're ready to begin sort of separating ITBN from quad, all you got to do is start to turn your body. Now, keep in mind, I am keeping my full weight of my leg in the ball. I am not gripping. I am not locking my knee. My leg is inactive, okay? So I'm not holding it straight. I'm not sticking it out nice and long or anything like that. I'm letting it drop all the way into the floor. I'm surrendering to gravity. This is how you're going to get the ball to go as deep as possible. So I'm going to continue to the front. I'm not going to go all the way to the front center of the thigh, because the main area that I'm looking at here is this transition, sort of 3/4 line here. Not quite full side, not quite totally front. And along the way, what's going to happen is I'm going to feel big bumps. This is the little spots that Yamana calls speed bumps, which is a really apt term because it does sort of remind you to slow down, right? We don't want to fly through these. We don't want to lift up over these spots. We want to push right through them. We want to disperse the tension. We want to dissolve the stickiness. So I've gone side to side a few times. And you can do that. You can go, sort of forward, back, side to side when you're working in this sort of horizontal intersecting of the muscle, this thing we call cross fibering. When you're ready, we're going to bring it down a little lower. So we take a breath in to start. Really let your leg be relaxed. Slide your body an inch or two towards your head. So the ball's going to traction that ITBN. It's going to find places that it's stuck on the surrounding area, and it's just going to sort of let it unfurl right here. And again, it's pretty intense, and it's usually more intense the closer you get to the knee, FYI. So it might start out like, okay, I can do this, and then as you get lower, it might become more and more intense. If you really want more pressure, you can stack your legs. If that's too much, you can scissor your legs, do whatever you need to do there. So I've had a few breaths right here, right in the sort of side bullseye belly of the ITBN. I'm going to start to, after a few breaths there, I'm going to start to cross fiber. So I'm twisting to the front. I can feel the ball peeling the quads away from the ITBN as I do this. And again, I can feel those speed bumps. I can feel those hot spots that need a little extra time and breath and attention. I'm going quicker right now than I might do this if I were really troubleshooting an injury in my body. Now, you can kind of guess what's going to come next, right? One of the great things about the Yamana work, it's really intuitive. Once you have the basic concept, you can apply it to anywhere in your body. In this case, you would continue down. Every takes 3, 5, 10 breaths in each spot. Every time you're ready to move, you take a breath first. On the exhale, you slide the ball down. When you get to the knee, we're not going to go directly on the outside of the knee, so you can kind of do a spot right here just before the patella, the kneecap there. You don't want to go right on it, but this is a great spot to spend a little bit of time as you cross fiber right around the beginning of the knee there. And then you would just skip that outside part of the knee and finish off on the outside. You can turn your leg out a little bit to get it to the point where it attaches to the tibia. And I'm using my foot to just press into that a little bit. So same idea, I'm kind of rotating forward and back and peeling the ITBN away from the surrounding muscle. And fascia too, so all the tissue around it. So in real life, you would definitely do both sides. So you're never going to do just one side, even if you have one side that gives you a lot of trouble, or if you have an injury on one side, you might be tempted to sort of spot treat and only work the one side. Don't do that because, excuse me here while the sirens pass, don't do just the one side, because what will start to happen is you will start to create a sort of compensation for your compensation. So make sure you're always doing both sides. So that hopefully is illuminating for you to understand what to do when you have knee, ankle, or hip pain that you believe is related to your IT band. Don't just randomly roll up and down it. If anything, start at the top and roll down, past the knee, and along the way, do some of that cross fibrating, because the main culprit of your issue is most likely that the adhesions are pulling the quads and sometimes the hamstrings too towards the IT band. So that's it in a nutshell. So there's your last tiny tune-up of 2021. I will be around in 2022 as well, so hope to see you next year. And in the meantime, blessings, Happy New Year, love to all.